Ohio is trying to fight opioid abuse with new strict limits on prescriptions. Governor John Kasich announcing the new rules yesterday. They say doctors can only prescribe up to 7-day supply of opioids for adults. The number of days is reduced to 5 for kids and teens, but there are, of course, some exceptions to those rules for cancer and hospice patients. We should point out that in 2014, Ohio had the most opioid overdose deaths in the nation. Will the new rules help the opioid epidemic? Joining me now is Dr. Devi from the NYU School of Medicine, specializing in pain management. Just the right gal to talk to, Dr. Devi. So, do you think the new regulations, first of all, are necessary?
I think something needs to be done to combat this epidemic. I mean, just to be clear, the doctors can actually continue to prescribe medications to the patients, but in that case, if they are prescribing more than those numbers of days, they have to explain why. So I think that's fair enough. And these limits primarily apply to primary care physicians or people treating acute pain. So that's the pain, for example, if you have a bad fall. They can always refer the patients to a pain management specialist or somebody else who treats pain more chronically, and the patient could have access to more medication if they needed it.
Governor Kasich mentioned that this is, obviously a multi-pronged attack. They're doing all sorts of things, spending money, busting people. He says limits the doctor shopping, shutting down pill mills, in addition to these regulations. But that's the question. Do you think these regulations will actually help stem this opioid crisis we're facing in the nation, especially there in Ohio, which has been sort of ground zero in a way?
It's a step towards it. I mean, if you think about it, the real problem is addiction, right? That people are addicted to these medications and then that's leading to drug overdoses. When we've looked at studies in animals, for example, or humans to look at what causes addiction, there are 3 general categories. So some people are just predisposed to become addicted to things. Some people are not. So even if they get exposed, they don't become addicted. But most of us are sort of in this middle category where if we are exposed to a lot of stress, then we're more likely to develop an addictive disorder. So in this situation, taking away opioids doesn't really combat that problem. But at the same time, I think one of the issues is that people are under a lot of stress, financial stress and otherwise. And then to have these drugs readily available, more available than they ever have been in history, probably was adding to the problem.
Dr. Devi, thanks so much for your expertise. We'll talk more about this on the program. Thanks for joining us.